How's it? This is Joel Agrivi, founder CEO of Paubox. I'm here in Oakland Hills, California with Zenaida Penetrante, founder of Holistic Care at Home. I got some fresh coffee with me and we're ready to go for the August version of HIPAA Center. Zenaida, thanks for having us.
Thank you for visiting us.
Yeah, can you tell me more about your company?
Well, we are a home health agency. It's a Medicare certified home health agency. We help the patients transition from facilities, from hospital, nursing home, to their home, wherein it's ordered by the doctor for them to learn how to manage their illness and have us teach the patient and the family member in order to continue with their daily lives and recover from the illness that they had. It can be temporary, or they can temporary homebound, or they can be, some patients are permanently homebound, and if there's a new problem, we're there to help them, such as wound care, if they need IV infusion, if there's new medication that the caregiver have to learn, we teach them that. And of course, it's an intermittent visit, and until the patient and the caregiver learn how to manage their illness.
Great. So I imagine there's probably a good segment of people who prefer to have care at home rather than being in a facility, and that seems like your folks' sweet spot.
That's right, because that will help the medical issue about the whole country, that it's more inexpensive for patients to take care of themselves at home. Well, again, such as IV infusion, wound care. These patients don't have to be in the hospital or in a skilled nursing facility if it can be taken care of at home.
Got it.
Yeah.
And you mentioned you folks are Medicare certified.
That's right.
Is that can you tell me more about that process?
Well, it's a lot of process. You have to follow regulations. We learned it from the Title 22 regulations from the government, and you have to have the right clinicians, professionals to work with this type of business. They all have to be clinicians have to be all certified for nursing, physical therapy, occupational therapy, and of course home health aid to help with personal care, and of course social worker.
Wow. And I imagine HIPAA is involved in all of this stuff, the HIPAA regulations?
Yes. So we have, when we admit a patient to our case, we have a consent form wherein we tell them that your information are safe with us. We will only share it with clinicians who needs that information. Information that's needed by the doctor, by the physical therapy, occupational therapy, social worker, nurses. And so it's all within the group only. We're not going to share it with anybody.
Got it.
Because it's safe with us.
Right.
Yeah.
And part of that, I imagine, is communication internally with other doctors, getting reimbursements. Have there been any challenges around that, or how are you guys addressing those communication issues? You
helped us a lot with the HIPAA communication because you provided the service for the HIPAA regulated email. So yes, we're using the email coming from you guys.
Fantastic.
We use it to all our clinicians.
And these people are on the road a lot, so I imagine they're on their phones and laptops and
with their smartphone.
Smartphone, right? Got it. Oh, that's great. And where do you see the future of your industry going? Is it positive, negative?
Oh yeah, positive.
Yeah.
Of course. I have to be positive. Well, first, of course, I see that because we already are being known. I think we're known in the community already as a home health agency who are compassionate, and we have holistic approach to our patients. And what is holistic approach? It's in our brochure. It's a body, mind, and spirit approach, wherein, of course, you have to assess the patient or everyone, just like with making friends. You want to feel them out as if finding out if they have a good sense of well-being and have some type of consciousness of taking care of themselves, and support system of the patient. So what I really want with this company, I know by the time we get the patients, they already have an illness. They already have a set ways of habits. But when we come into their life, we want to help them with or guide them with their changing their daily habits, such as eating healthier food as opposed to drive-through food.
Fast food,
junk food. These are little baby steps in life that they will learn from us, and these are things that the most difficult actually, because teaching medication will be okay, you know, like, so this is your blood pressure medication, blah blah blah. This is your antibiotic. After the antibiotic, it's done. Are they going back to their bad habits?
Right.
You know, so it's baby steps, guidance to their bad habits.
Yeah.
Because we're promoting exercises. So when they go home, coming from the hospital with certain illness, we come in there to teach them how to treat that illness or wound or complete IV antibiotics. But we want to discharge them. Of course, we have to discharge them, but I want them to learn something from us that hey, it's been 60 years of my life. I did not practice healthy lifestyle. So at least they will at least have some touch of reminder what food that are fresh food. Eat fresh food as opposed to drive-through.
So that's the holistic part.
Yeah.
That's great.
Why
and
not?
At home. So that's a nice
And at
combo.
home. So home health, the idea of home health is that they should be homebound patient. Either they're permanently homebound or temporarily homebound. So that's the idea. Otherwise, it's a no-no. That's bad if you're providing service and the patient's not homebound.
Oh, I see.
Yeah.
And what's the average age of, are these baby boomers? Most
Yeah,
of your
they're
patients?
baby boomers now.
I see.
Yeah, they're 65 and above. Yeah. And, well, of course, there are patients who are homebound too that for some reason they're disabled. Yeah.
But most of your
It
patients
has to
are-
be homebound. They have
I
to be
see.
homebound.
Yeah, I was doing some research a few months ago, and I think there's 10,000 at least baby boomers retiring every day in the United States. So
Okay.
I think
Well,
the trend will stay a lot of people retiring, and
yeah.
will be those with health issues.
Well, the best solution for our medical issue is that prevention anyway. So if, for example, if we have a family member who was hospitalized and we're able to provide service at home, at least we will teach the grandmother maybe, and then whatever teaching we have, she can pass it on to the caregivers, which is their daughter or their grandchildren, to remind them healthy living is the best way to have a better life.
That's great.
Yeah.
Sounds like a really strong business.
Yeah. Well, what else with my business? So business is still about being highly regulated. This is highly regulated business. Of course, it's a client, service oriented. You have to be compassionate with patients you touch.
Yeah.
And a lot of support is given to the family.
So speaking of compassion, can you tell us how you and I first met?
Oh, okay. That was in 2016.
Last December.
Was it last December? So I came from one of the facility for psychiatric patients in San Francisco.
Yep.
These patients are not. They have a psych problem, but they live in one of those Victorian houses that has a license for psych patients. Should I say psych patients? Is that allowed? So I visited them. I did blood work for them for their monthly blood work for medications, and then I passed by. You guys were in the BART stop giving away food.
Yep.
And then I was like, what are you guys doing?
Yep.
So, you said you were giving away food. It's a community service.
Yep.
And of course, that area where the BART stop was the Mission and 16th
That's right.
Street. So I asked you for the food because I want to carry some to the guys too.
Yep.
In the
You
site.
asked how you could help, and I
Yeah,
said,
I
"Oh,
did.
we're good. We're just trying to give out this food." And then,
Yeah.
we started talking about what we did, and he said, "Hey,
And I said,
I
what?
might be able to use this."
What? HIPAA regulated email? Yeah, that's what I need.
Yeah.
So that was funny. So yeah.
That was cool.
Yeah, that was cool. So I came from helping other people, and you're trying to help people too
Yeah.
on the street.
It's
Yeah.
a good match.
Yeah, it's good. So I'm happy we're using your service.
It's great.
Yeah, easy.
We love having you guys as customers for sure.
Yeah.
Just perfect match for
Perfect
what we're trying to
match.
do.
Yeah.
That's it.
That's all?
Thank you very much.
Okay.